Hey guys, hope you all doing well. So let's start top 10 questions, most asked questions in any nursing entrance exam of your respective country. Okay, so every day we will practice 10 questions with answer and rational. Okay, so do watch this video till end. Yeah, and do not forget to like and share my videos and subscribe my channel. So let's start. The first question is, before administering 2 units of whole blood, what type of intravenous device should be used? Option A, whatever the doctor has ordered, consult the patient's chart. Option B, a large bore catheter to allow blood cells to pass easily into the patient. Option C, the smallest possible catheter to prevent pain or on insertion. Option E, the same IV device as previously used, consult the patient's chart. Okay, so the right answer is option B, which is a large bore catheter to allow blood cells to pass easily into the patient. So let's see the rationale. Large bore catheters are necessary to prevent damage to blood cells. This also decreases development of clots from hemolysis. Okay, let's see the second question. A patient who is diagnosed with Parkinson's disease states, I can't tie my shoelaces anymore. The healthcare provider recognizes that the patient's problem is due to a deficiency in which of this neurotransmitter. Which of this neurotransmitter from the option? Serotonin, B glutamate, C dopamine, and E norepinephrine. I hope you already know the answer, which is dopamine. Parkinson's disease is a progressive neurodegenerative disease that affects the motor system. Dopamine helps the brain to control movement and coordination. Here, neurons in the brain slowly stop producing dopamine. Let's move to the third most important question, which is the safest method of changing a patient's tracheotomy ties is to option A, never attempt to change ties alone. Option B, change ties as soon as possible after the patient has eaten. Option C, apply the new ties before removing the old ones. Option D, ask the doctor to suture the tracheostomy in place. Okay, so the answer is apply. Option C, apply the new ties before removing the old ones. Let's see the rationale. The best way to change tracheotomy ties is to apply the new ones before removing the old ones. This keeps the tracheostomy in place during the process. Let's see the 4 number question. The healthcare provider is caring for a patient on a ventilator with an endotracheal tube in place. What assessment data indicate that the tube has migrated too far down the trachea? The options are option A, decreased breath sound on the left side of the chest. Option B, a high pressure alarm sound. Option C, low pressure alarm sound. And option D, which is, I think I have written E instead of D. This is D, increased crackles auscultation bilaterally. Let's see. So the right answer is option A, decreased breath sound on the left side of the chest. Okay, so if the endotracheal tube is inserted too far, it will often goes into the right main stem bronchus. Air will then be delivered to the right lung and not the left. Let's see the 5th one. Parents of a 9-year-old girl with a new diagnosis of type 1 diabetes, T1D means type 1 diabetes, ask the nurse what caused their daughter's disease. The nurse knows the pathology is option A, increased hepatic glycogenesis. Option B, pancreatic beta cell destruction. Option C, cells become resistant to insulin. And option D, atrophy of alpha cells in the pancreas. Okay, so I hope you know the answer. If you already know, just comment below. Okay, so the right answer is B, pancreatic beta cell destruction. Let's see why. Insulin is produced by beta cells in the pancreas. When the beta cells are destroyed, no insulin is available. Okay guys, if you need broad explanation of these questions, then you can tell me. I will take classes, like suppose if you have any problem in diabetes, then I will take a class on diabetes so that you can understand all these things. Okay, let's move to the sixth question. The healthcare provider is caring for a patient who has septic shock. Which of this should the healthcare provider administer to the patient first? Option A, corticosteroids to reduce inflammation. Option B, antibiotics to treat the underlying infection. Option C, vasopressors to increase the blood pressure. And option D, IV fluids to increase intravascular volume. Okay, so correct answer is option D, IV fluids to increase intravascular volume. Circulation and perfusion are addressed first, so IV fluids will start it immediately. Let's move to the seventh question. Which of this assessment findings should the healthcare provider expect to identify as an early clinical characteristics of multiple sclerosis? Dementia, option B clonus, option C muscle atrophy, option D vision loss. Okay, so if you want me to take a separate class on multiple sclerosis, comment below, I will take one. Okay, the answer is vision loss. Let's see why. Multiple sclerosis is an inflammatory demyelating disease of central nervous system. What is the meaning of demyelating? Comment below. If you don't know, I will make you understand. And vision loss are early symptoms of multiple sclerosis due to the inflammation of the optic nerve. Okay, in multiple sclerosis, optical nerve get inflamed, so that's why vision loss occur. Let's see the eighth question. During an assessment of a patient experiencing acute hemorrhage, the healthcare provider would most likely to expect to find option A nausea, option B tachycardia, option C jaundice, and option D hypotension. Yeah, so the right answer is tachycardia, option B. Let's see the rationale. The heart rate will increase in an attempt to deliver more oxygen to the brain and the body. Okay, let's see the ninth number question. Female patients complains of abdominal discomfort. Watery stool has been leaking from her rectum. This could be a sign of A, fecal infection, B, diarrhea, C, bowel incontinence, and D, constipation. The correct answer is option A, fecal infection. Let's see the rationale. When constipation is not resolved, stool becomes hardened and unable to pass. Liquid stool then may pass around the impaction. That's why liquid stool was leaking from rectum. Let's see the last question. 10th question means with a stroke patient, what is the best position for insertion of a nasogastric tube? Option A, low flowers, option B, supine, option C, Trendelenburg, and option D, high flowers. Right answer is high flowers. Why? It's the best position to avoid aspiration. Okay, so if you have any doubt in any points, if you want to, if you want me to upload a topic on any of this, point, specifically any of this topic, then let me know in the comment section. I will upload. If you have any doubt, let me know. Thank you. Bye.